Types of pressure relief. If you can move your body on your own, you should do pressure relief every 15 to 30 minutes. If you need help, you should relieve pressure every 30 to 60 minutes. Each position should be held for 1 to 3 minutes for the blood to go back into the tissues. People who are weaker do not move as much during the day. The less often you engage in pressure relief, the longer you should hold each position. Even if you always sit with a small tilt or recline, you still need to fully get into the pressure relief positions to spread the pressure off your bottom. For each position, you will hear a recommendation for how far you should go. The most important thing is that you move as much as possible to give your skin a break. Pressure relief positions. Position 1. Standing. If you can stand safely with or without support, this takes pressure off your bottom and back completely. If you cannot stand, some equipment can lift you to standing. Some power wheelchairs are equipped with power standing, which pushes you into standing from sitting. Other items such as standing frames and sit-to-stand lifts pull you to a standing position from sitting. Position 2. Lying down. This does not take all the pressure off your bottom and back, but it spreads the pressure out along your entire body. If you are lying down for a long time, make sure to change position every 2 hours. Switch between lying on each of your sides and lying on your back. Position 3. Reclining in a recliner. This moves you from sitting up to almost lying down, but does not move the pressure off your bottom to your back the way lying down in a flat bed would. Because a recliner never becomes completely flat, there is always some pressure being placed on your bottom. Position 4. Hospital bed with head of bed elevated. Like reclining in a recliner, the pressure does not fully move from your bottom in this position. You may need to bring the head of the bed up for comfort and safety when breathing and swallowing while lying down, but remember that you might need to do more pressure relief as well. Position 5. Leaning. This can be done on your own or with the help of others to both move in and out of the position while keeping your balance. Lean forward and to each side as much as you can handle. Research says you should lean about 35 degrees forward or diagonally to fully take pressure off your bottom, which is a little less than halfway to becoming flat. When you feel your bottom come off the seat a little, you are getting good pressure relief. Wear a seat belt to prevent sliding out of the chair when you are leaning. Position 6. Forward lean. Lean your chest forward and use your knees, armrests, or something stable in front of you to stay balanced. Position 7. Side lean. Lean to each side, holding yourself up on the arm of your wheelchair. Be careful. While this takes pressure off from half of your bottom, it also puts more pressure onto the other half. Make sure to lean to both sides for about the same amount of time to take pressure off your entire bottom. Position 8. Diagonal lean. Lean forward and slightly to one side, using your legs and armrest for support and balance as needed. Like leaning to the side, make sure to lean in both directions to fully take pressure off your bottom. Position 9. Tilt in space. Tilting in a wheelchair brings the entire chair backwards or forwards without changing the angle between the seat and the backrest. This helps you stay in the same position while doing pressure relief and can help you scoot back in the chair if you need to. Tilting moves some of the pressure from your bottom to your back. Research says you should tilt to at least 20 degrees, and some people like to go all the way until the chair stops moving, which is 45 to 55 degrees. Position 10. Anterior tilt. This is an additional option available on Permobile wheelchairs. It tilts the seat of your chair forward and moves pressure to your legs and feet. To feel more secure, recline slightly before tilting forward and wear a seatbelt. This way you will not feel as though you will fall forward. Position 11. Recline. Recline brings the backrest of the chair back without moving the seat of the chair. This moves some of the pressure from your bottom to your back. Like lying down in a recliner or a hospital bed, recline does not fully take pressure off your bottom. Be careful when coming out of recline because you are more likely to slide forward in your seat. Use a seat belt, tilt, or both together to help prevent this. Research says you should recline to at least 35 degrees from upright or 125 degrees total. Position 12. Foot platform elevation. Foot platform elevation helps straighten the legs, stretch them out, and bring the feet up. The platform brings the knees up before stretching the legs out, giving you some air and space under your legs. It can give some pressure relief, but works best when done with tilt and recline. Position 13. Tilt and recline. Tilt and recline together give good pressure relief and help you keep your position in the chair. Research says you should recline to 35 degrees from upright or 125 degrees total and tilt to at least 20 degrees at the same time. When coming out of the position, come out of recline first, then tilt. This will help stop you from sliding forward out of the chair. This position needs a lot of space and can make it so that you cannot do many things. It does not work well for all situations. For people with extra tissue on their chest and stomach, tilt and recline together often is the only position where you can manage moisture and let air onto the skin folds there. This can help prevent injuries from happening in those areas. Position 14. Tilt, recline, and foot platform elevation. Adding foot platform elevation spreads the pressure from your feet and heels to your calves. Also, raising the feet above the heart improves circulation, may help swelling, and stretches the leg muscles. Position 15. Recline and foot elevation. When recline and foot elevation reach their farthest position, you will be laying down almost flat. Though this is a good position for resting and completing some ADLs, because you are not completely flat, it does not fully take pressure off your bottom. Alternate between recline and foot elevation when getting into or coming out of the position to feel more secure and to decrease the stretch in the backs of the legs.